There you
There
are.
you go.
All
No,
right, perfect. Glad we got this figured out.
perfect. Perfect.
Perfect. All right, well, everyone, I'm here today joined with James White, the CEO and owner of KBMO Diagnostics. And if you don't already know what that brand is, we are obsessed and love their food sensitivity test. We recommend it to everyone. So if you've taken the test, that's KBMO. So you just came out with a new test, and we would just love to hear a little bit about it.
Perfect. Well, thank you for that intro.
Yes.
We're very fortunate. We've got some great providers out there, and all our testing we do through
Yeah.
providers. And Lake one of the kind of forefront of those providers. So thank you for this
Yeah.
opportunity to talk a little bit more about our CIT
Yeah.
test. So that goes along with our FIT test.
Yep.
So
Yep.
so the food inflammation test. So the CIT is the cardiovascular inflammation test, on the basis that everything in your body is pretty much interlinked. So what we're seeing is, with your diet, we control lots of things linked to inflammation,
Hmm.
but also cardiovascular. The root cause of that is inflammation. So we went, let's look at a cardiovascular inflammation test rather than the food inflammation
Right.
test. And the reason we wanted to do that is cardiovascular is the #1 killer in the US. And
Mhm.
it's a massive issue for all of Lake Country's clients and most other clients around the
Yeah.
world as well. So
Yep.
we looked at it and said, how do we come up with a test that would be a finger stick, like our food sensitivity test, so it'd be
Yeah.
easy to administer in the office, and also cover some of the key markers that are being forgotten about
Sure.
as people are looking at cardiovascular health today. So the stunning thing that we found when we started putting this together was the standard lipid panel that all cardiologists run on you today.
Yeah.
The patients who have heart attacks, 50% of those have a normal lipid panel on the day of their heart attack. So we suggest that's probably not a great standard of care. So we thought we must be able to beat that. And
Yeah.
so that's what we've done. So rather than leaving that standard lipid panel alone, we added a thing called direct LDL, which means that rather than it being a measurement, it's a direct measurement from your blood versus
Right.
different markers. And so that's one of the huge upgrades. And then
Yeah.
a couple of the other things we wanted to add were things like ApoB and LP(a). So ApoB is the #1 marker for cholesterol. And if you're outside the US, it's run standard for most
Oh.
patients. For some, we've decided not to do that here in the US, and only 5% of the population has been tested for it. So we're like, okay, let's add that, because
Hmm.
that'll be a neat one for all our good providers to kind of test their patients for.
Yeah.
The other one there that I mentioned was a thing called LP(a), which is another genetic marker, which basically talks about how aggressive your plaque is in terms of building up, in terms of, which is a key element, obviously, for cardiovascular disease.
Yes.
And this one is a staggering one, because 1 in 3 of the US population is wandering around with this genetic marker. And it would have a really big impact on how you're treated. Because again, if it's telling your provider that your plaque buildup is going to be more aggressive, then they'll treat you differently
Right.
than just saying Lp(a) is low, or it was not relevant for you.
Right.
And so what we did was, again, rather shamingly, only 1% of the US population has been measured for this. So although 1 in 3 of us have it, only 1% of us have been measured. So let's put
Okay.
that there as well. So that was the kind of concept here. Let's
Yeah.
put some markers on, which are really key and critical. And even as I was driving into work this morning, there's another study coming out linking with obesity, with cancer, and cardiovascular disease, and
Oh.
metabolic
Sure.
disease. And so other markers we added was high sensitive CRPs, which is called C-reactive protein. And that was one of the key indicators on that study. So again, what we've tried to do is, rather than leave people with a rather poor, shamefully poor lipid panel, we thought we'd add some markers that were unlikely for patients to have been tested for currently, but have got a dramatic impact on how we can improve their overall health. So the HSCRP, the high sensitive CRP, as I mentioned, ApoB for cholesterol, and then the LP(a) to see how badly your plaque buildup is based on your genetic makeup. So that's the panel, and that's, as I said, the key thing with it is it's a finger stick. So
Yeah.
again, that makes it really easy to do and administer. Lake Country do an amazing job on our fit test, which is a finger stick.
Hmm.
And so now what we're hoping, slightly different card, but the same principle, that we can get that kind of level of information into their hands as well. So
Right.
it really gives you a great way of working out what's going on from a food inflammation standpoint. We've now added a gut barrier panel, so you're looking at what's going on from an immune health, And now with the cardiovascular, we can see what's going on from an inflammatory standpoint with your cardiovascular health as well.
Well, James, that's so amazing. That is something much needed. Obviously, with the low testing, with everyone across the U.S., that's amazing. I think we'll see an increase in numbers there for the testing of those markers that you mentioned. Um, so yeah, it's super easy because our fit test is we can do it here for you or we can send it to you. And that's what's so amazing about that is that you don't have to be in office all the time for this. We can send it to you and you can do it yourself, and it's just really simple. So that's amazing that your CIT is going to do the same thing. Just efficient, simple, easy. So
The nice thing about it is, we talk about these things being interlinked. So we did a study looking at IBS patients, so irritable bowel syndrome, very obviously gut related, and you think that links more to the food. But we
right.
also measured as part of that triglycerides and high sensitive CRP again. So again, there's this really strong interrelationship between cardiovascular health and gut health. And so again, as Socrates said, all disease starts in the gut. So again, the key is how do we make sure we can really make sure we heal the gut, but also take advantage of some of these cardiovascular markers to see if we can help clear those up as well.
That's just so amazing to me. So question for you. How often should someone take this test to keep track of their health?
So again, I would say probably it's an annual test in terms of to make sure we can see what's going on from a cardiovascular health standpoint. Because with all these disease states, the key is testing often and early to make sure it's preventative care versus, unfortunately, most people get these lipid panels, as I said, on the day of their heart attack or something like that, when it's way too late. The sooner you can be on top of this stuff, the better. In fact, February was Cardiovascular Health Month. So what we did here at KBMO, all of the employees here were tested for their CIT test. So again, what we want to make sure is encourage not only just our employees, but everyone to run this test on a regular basis to make sure that they can take control of these markers and understand what they mean, and more importantly, get ahead of their health to make sure that they, that they live a long and active life.
Amazing. Yeah, prevention is just so key and important. And I haven't heard anything like your test at all. And like you said, like standard testing is not anywhere near enough for, correct prevention and more information. So I just think that's super neat that you guys came out with this. Such a great idea. So just it's going to be extremely beneficial for anybody. I assume that not just anyone that maybe is concerned or have symptoms already of their cardiovascular issues or obesity, you would probably recommend that anybody, any age, take it to see, our risk or prevention.
Absolutely. And again, that's back to that LP delay, which is a genetic marker. So again, something, the sooner you take it, the better, because then you can pass that information on to your healthcare provider who can say, okay, great. Now that we know this, how are we going to treat you slightly differently given that that marker is elevated? And I always think it's slightly disingenuous with a lot of these genetic tests that go, well, 2% of the population may have it. Well, they may do, but this one is 1 in 3. So again, it's really something that you should consider, that it's a high proportion of the US population has it, and global population. So again, we want to make sure we can get you ahead of that and make sure your provider is aware of some of that really important information from a cardiovascular health perspective.
Perfect. Well, I think that this live was very educational, and I really hope that people watch this and they learn. They're like, yep, I need that. So I hope this live was more information to help you just with your health for sure. So thank you so much, James. We really appreciate you. We love KBMO. So thank you for taking the time and joining us today. We are just so excited and happy to promote this.
Wonderful. Well, thank you very, very much indeed. And as I said, we're very fortunate that we've got some great providers like yourselves running the testing. And again, it's a great opportunity for people to kind of get tested early, often, to make sure that you can stay ahead of your health.
Yep, perfect. You worded it so well, James. Well, it's so great talking with you, and I hope you have a great rest of your day.
Wonderful. All right, take care. Thanks for your time.
Yes, thank you.